everyone. Sandy Grove here again with Health Tracks at Home. Again, we're going to talk about how to be a good health advocate for yourself during COVID-19. And today we're going to discuss some things that are questions about use of facial coverings. I hope I will be able to use the experts. I'm going to be quoting from quite a few in the infection control industry that can help answer some of these questions that we've all asked, and they're good questions. So I hope that I can alleviate some of your concerns, and we're going to eat the meat and spit out the bones today. So we've heard a lot about the CDC and WHO, et cetera, so I'm not going to refer to them as much as I normally would because they're my go-to people. So I want to hear from some of the other authorities out there. The University of San Francisco answered a good question. Why did the CDC change its guideline on wearing masks? Remember, at the beginning, we were not wearing masks and we were not recommended to wear masks. And now we look back and we go, why didn't they do this? And why didn't they close our borders? And why didn't they? And we're now asking, why didn't they do this? So I thought this was a really good explanation. The quote says the legitimate concern was that there would be a limited supply for healthcare providers. Remember back that we didn't have enough equipment that we needed during that time. And so the other thing is that, yes, we should have been told to wear a facial covering at that time, right off, but culturally we were not ready for it. The US was not ready to be asked to wear masks. Other countries are used to that. When they're sick, they put on a mask. But in the US, we don't do that. And I think that was a very valid concern that we kind of had to ease everybody into the need to wear a facial covering. And we had to make sure our healthcare providers had enough masks before we started getting out there and people started making facial coverings, et cetera. So once we had a clearer understanding that both pre-symptomatic and asymptomatic transmission is possible, that means people have no clue they have COVID quite a few days beforehand. Then they recommended masks for everyone, and that is why. So the University of San Francisco agrees with it, and the head of the infectious disease department at the University of San Francisco said now he's got the 3 W's. The 3 W's to ward off COVID-19. Wear a mask, wash your hands, watch your distance. I like that. That's Dr. Chin Hong from University of San Francisco. Another one. So why weren't facial masks recommended at the start of the pandemic? That's from Mayo Clinic. They basically said the same thing. And they said experts didn't know to what extent people would spread the virus before symptoms appeared, nor was it known that people wouldn't have any symptoms with COVID-19. So both groups could unknowingly spread the virus to others, hence what we know now. Stanford University answered, how do facial coverings prevent the spread of COVID-19? And I thought this was a really good little article. It says that we needed to go to the source. The source is the droplet of the virus, okay? And we need to understand that 40% of people infected with the virus that causes COVID-19 may have no symptoms. We've all heard this on the news. That's a lot of people walking around. Almost half of the people walking around, they have no clue they have the disease. They think they're healthy, they think they're whole, and they are spreading it to other people. The other thing is, but when they talk and they cough and they sneeze, they spread the virus to others in the form of respiratory droplets. We've talked about the difference between a droplet and fine particles, remember? And people have actually said, well, the masks don't work with the fine particles, so why are we bothering to use this? This is going to talk specifically to that. It says that respiratory droplets are expelled into the air, and those droplets evaporate into fine particles that linger. Okay, so the mask traps the large droplets. I love this article because it really helped me understand those larger droplets before they can evaporate. So it is a definite shield at the source to prevent you from getting it, because those fine particles are going to come in if you don't stop the large ones. So I thought that was a really good thing. And so that's preventing the spread from the source. And that's Dr. Larry Chu, the director of the laboratory at Stanford University. Mayo Clinic also chimes in here and said the cloth mask is intended to trap the droplets, again, that are released when the wearer talks, sneezes, or coughs. Asking everyone to wear a mask can help reduce the spread of the virus for people who have COVID, but they don't know they have it. There was a clinical trial done by NIH and some other companies about the efficacy of public using facial coverings. And it stated that in the community, masks appeared to be effective with or without hand hygiene. I thought this was an interesting study, but they said, but both together are more protective. And that is why we are being told to do the multiple things: social distancing, wash your hands, wear a mask, stay at home. So because we do not know if someone is transmitting the disease, because many people, as we said, 40% are asymptomatic and can transmit the disease to other people. So first of all, I wanted to cover, per the CDC guideline, who's not supposed to wear a mask. So there's not very many people. So masks should not be worn by any children younger than 2 years of age or people with trouble breathing. And that would be something you talk to your doctor about, or anyone who is unconscious or incapacitated or otherwise unable to remove their own mask. So somebody that might be confused or has some kind of disability, probably that cannot get it off themselves, should not wear it. So I wanted to talk all of the major healthcare providers: Kaiser, Scripps, Sharp, UCSD, all have wonderful COVID information on their website. I went and I looked at all of them, and they all have a little bit of difference. So it's kind of fun to go and read what they say, but they all agree about the mask. So I'm going to, Sharp Healthcare System just publicized out recently 5 face mask myths. So I thought this covered some things that we should talk about. And I thought this is a great parameter, but all the other ones have it. Go to your healthcare provider. I'm going to mine, Sharp. So that's why I'm using it. So myth number 1, you can use anything as a face covering as long as it's in front of your face. Well, not really is the answer. According to the California Department of Public Health, suitable face coverings for the general public can be cloth face coverings, disposable medical masks, or a plastic face shield with a drape attached to the bottom. You may have seen some people walking around with a shield with cloth on the bottom. That's probably because they can't wear a mask, so they're wearing the shield. Those are the only 3 things that are approved. So a recent study found that masks made of 2-layered quilting cotton blocked the most respiratory droplets from spreading when compared to the other types of masks worn by the general public, such as a bandana or loosely folded cotton handkerchief or cone-shaped disposable masks. So they do not recommend the cone shape, which my husband uses. So now he's not going to use those anymore. So we're going to get him regular paper disposable masks. We've got those on order. So I just wanted to point that out. There's a recent study, and you can go on the Sharp website and go to that study and read about what it said at sharphealthcare.com. Myth number 2, as long as I'm covering my mouth, it's okay to have my nose exposed so I can breathe better. And I know all of you are going, oh yeah, I see people do that all the time. And the answer is not true. So I don't need to go into much detail about it. The CDC offers to follow do's and don'ts about wearing a mask, and we're going to cover that next week. We're going to cover how you put it on, how you put it off, take it off, and the things to make sure that you do. And my thing that I just want to pass on today is make sure you keep it at all times. Don't put it up here. Don't put it down here. If you're going to remove it, take it from here. Try not to touch your mask any more than you absolutely have to. Remember, your hands now have the virus on it if you've been exposed to anyone, so make sure you wash your hands if you remove your mask. Myth number 3, wearing a mask is dangerous because it doesn't allow you to get enough oxygen and causes you to breathe in too much carbon dioxide. This keeps a lot of people from wearing masks. It really did frighten a lot of people out there. So I want to quote a couple of different places. The World Health Organization, who Sharp uses, disagrees, saying that prolonged use of masks can be uncomfortable, but it does not lead to carbon dioxide intoxication or oxygen deficiency, or healthcare providers could not wear them for 8 to 10 hours at a time. Stanford University research scientist Amy Price says it's just not true. A properly constructed mask provides more than enough ventilation. In fact, one way to test if your mask is well made is to try and blow out a candle through the mask from about a foot away. If you can't do so, your mask might be too tightly woven, but it may be that it is giving the proper protection to the other people around there. Just make sure that you're not getting too hot or you cannot breathe. Also, she says wearing a mask reminds people to continue to be cautious. With a mask on, you do not touch your face as often. So these are things that have been noticed in doing research projects. So people actually do touch their face less when they're wearing a mask. It's a good reminder. We don't want to be up here touching our eyes and our face. Myth number 4, if I'm wearing a mask, I don't need to practice social distancing. I don't think I need to go into this one. I think you all know that we've been told that the cough goes at least 6 feet, sneeze goes up to 26 feet. So a mask can only do so much. And so we do need to make sure we're using the social distancing as well. Like I said, it's all these things together that work to make you as safe to yourself and to others. Myth number 5, I don't need to wear a mask when I'm outside. Actually, sometimes you do. According to state and local health orders, people over the age of 2 years of age need to wear a face mask, when they're outside the home and unable to maintain that 6-foot distance. And sometimes that's, waiting in lines. We've talked about these before, shopping at a store, picking up food at a restaurant, in common areas where people are walking by, in stairwells and bathrooms, etc., waiting for a ride or public transportation, riding in a taxi, seeking health care, going to facilities that are now allowed to stay open, working at an essential job that interacts with the public, outdoors and unable to maintain the 6 feet, and you're not in the same household. So we kind of all know those things. So there's no need to wear a facial covering when you are in the car by yourself, swimming, walking, hiking, biking, or running by yourself or with your other household members. But you should be prepared with facial covering, have it readily available if you come within 6 feet of another person that is not part of your household, such as narrow sidewalks and going through a restaurant drive-through. So you can read more about these details, these specific ones, from Sharp at sharphealthcare.com. But like I said, all of the major healthcare providers have got a great section on the precautions and why you need to use all of them on their website. So please go there and take a few minutes to read it. So until next time, remember, your actions can save lives. Keep your community healthy by staying in place except for essential needs. Wash your hands and keep your distance. And please wear a mask for the following 3 reasons. I'm going to repeat them again in case you didn't see my video last week. This is my mantra. 1, humility. We don't know if we have COVID. It is clear that people can spread the disease before they have symptoms. 2, kindness. We don't know if the person we are near has a child battling cancer or cares for their elderly mom or is at high risk themselves. While we might be fine, they might not be. 3, community. We want our community to thrive, businesses to stay open, employees to stay healthy. Keeping a lid on COVID helps us all. Next week, we're going to talk in detail about the proper way to use a mask, the proper way to clean a mask, etc. And then we'll continue to go on with some of the other topics I mentioned a couple weeks ago. And you do take care. I hope this has been helpful. I hope it alleviates some fear, and God bless you.